Does Tirzepatide affect how well Plan B works? That's a really important question, and the honest answer is we don't fully know yet, but there are some real concerns worth understanding. Just a quick note before we dive in. This video is general health information, not a substitute for personal medical advice. Please talk to your healthcare professional about what's right for you. More and more people of reproductive age are being prescribed Tirzepatide, sold as Mounjaro or Zepbound. So, the question of how it might interact with emergency contraception like Plan B is becoming increasingly relevant. Let's start with what Tirzepatide actually does. It's a once-weekly injectable medication that helps regulate blood sugar, reduces appetite, and importantly, slows down gastric emptying. That means food and medications move through your stomach more slowly than usual. Here's why that matters. The FDA has flagged in Tirzepatide's prescribing information that this slowed gastric emptying may reduce how well oral contraceptives are absorbed. Because of that, the FDA recommends using backup contraception for 4 weeks after starting Tirzepatide and for 4 weeks after any dose increase. It's worth noting that this guidance is specifically about ongoing oral hormonal contraceptives. It doesn't directly address single-dose emergency contraception like Plan B. Plan B is taken orally, so in theory, the same absorption concern could apply. But here's the critical thing. No studies have specifically looked at how Tirzepatide affects Plan B's effectiveness. We're working with a theoretical concern based on how the drug works, not direct evidence. So this is genuinely an area of uncertainty. What we do know is that timing is the single most important factor with Plan B. It works best when taken as soon as possible after unprotected sex, ideally within 72 hours. If you need emergency contraception while on Tirzepatide, don't wait. Take it right away. Now, if you're in a window where absorption concerns feel especially relevant, like when you've just started Tirzepatide or recently had a dose increase, there are alternatives worth knowing about. Ulipristal acetate, sold as Ella, is another pill option. However, since it's also taken orally, it could theoretically face the same absorption concern. The copper IUD, on the other hand, is a non-hormonal option that bypasses the GI tract entirely. So gastric emptying isn't a factor. Both are effective for up to 5 days after unprotected sex. There's also an important nuance from ACOG. For individuals with a higher BMI, ulipristal or the copper IUD may be more effective options than Plan B. Though the evidence is mixed, this is definitely worth discussing with your doctor. Speaking of your doctor, this is a conversation worth having proactively before you're ever in a situation where you need emergency contraception. Ask your healthcare provider about your overall contraceptive plan while you're on Tirzepatide, especially during initiation or dose changes. On the safety side, if your period is more than a week late after using emergency contraception, take a pregnancy test, and if you experience severe lower abdominal pain, seek urgent medical care right away. That can be a sign of an ectopic pregnancy, which needs immediate attention. So let's recap. Tirzepatide slows gastric emptying, which raises a theoretical concern about oral contraceptive absorption, including Plan B, though no studies have directly examined this. If you need Plan B, take it as soon as possible. Timing matters most. The copper IUD avoids the absorption question entirely. Ulipristal is also oral and may face similar theoretical concerns. And if BMI is a factor, ACOG suggests ulipristal or a copper IUD may be worth considering. Talk to your healthcare provider to figure out the best approach for your situation. Have questions? Drop them in the comments. We read everything. And if you found this helpful, give it a like and subscribe for more videos from Fella Health.